Imagine this for a second. You're planning a vacation, right? Got the flights, the hotel looks amazing. Maybe you're thinking about tours, food.
The usual holiday planning.
Exactly. But then, sort of tucked into that same itinerary, alongside the fun stuff, is a root canal. Or maybe even heart surgery.
It sounds a bit jarring, doesn't it? But that's basically the reality now for, well, a growing number of people.
Yeah, it seems like the idea of traveling for serious medical stuff used to sound, I don't know, a bit last resort. Or maybe only for the super rich.
For sure. But today, medical tourism, or Dulisjaf, as it's known in some places we'll discuss, like Vietnam, it's really become this sophisticated global industry. It's professionalizing fast.
Right, so we're not just talking about maybe, cheaper cosmetic procedures anymore, although that's part of it.
No, it's much broader. It's about patients really acting like informed consumers on a global scale. They're using travel, using that infrastructure to find better care or faster care or maybe more specialized treatment than they can get where they live.
So today we're diving into that. We've got sources that map out this whole movement.
Exactly. Well, we're going to look beyond just the cost savings, so that's important. We need to understand the real drivers, what makes people choose this.
Things like clinical quality, the price, obviously, but also the huge effort countries make to attract these medical travelers.
And we'll look at the top spots, the destinations winning this race, and maybe most importantly, the kind of underlying healthcare system, that, safety net that needs to be in place to make it all work.
Okay, so our mission today is really to unpack these choices people are making, driven by quality, cost, and getting access to care now. This is a deep dive into healing on the move.
Let's do it.
Okay, let's unpack this. The blend of healthcare and vacation. All right, so let's start with the basics. Medical tourism, it's a term we hear a lot, but what's the sort of official definition? It needs to be deliberate travel, right?
Precisely. It's not just falling ill while you're on holiday. It's defined as intentionally seeking medical examination or treatment or therapy and combining that with some kind of leisure or recovery activity in another country.
The key is the primary motivation is medical.
Exactly. You traveled because you needed that care. The vacation aspect is often integrated, but the medical need drives the journey.
And the fact that this industry is booming, it kind of highlights a global mismatch, doesn't it? You've got places like the US or Canada or the UK with great doctors, sure, but maybe really high costs.
Or long waiting lists, sometimes agonizingly long.
Yeah. And then at the same time, you have other countries, often emerging economies, that have poured resources into building like super modern hospitals.
State-of-the-art facilities, staff trained internationally, often to the same standards as in Western countries.
So that's the core appeal then, the value proposition.
That's it. Patients are actively deciding, okay, I can't wait, or I can't afford this here, so they look elsewhere to places offering really high-quality care, demonstrably so, but at a price point that's, well, more manageable.
And the recovery aspect seems key, too. The idea of recovering somewhere nice, maybe relaxing.
It's not just a nice-to-have bonus. It's often integrated into the whole package. Think about recovering from major surgery, doing that in a calm, attractive environment versus, back home immediately with all the usual stresses.
Yeah, I could see how that would make a huge difference psychologically. It's not just about the bill at the end.
Absolutely. Our sources show that when patients choose a specific place, it's not just the price quote. Yes, they want shorter waits, but they're also looking carefully at the follow-up care.
What happens after the procedure?
Right. Is there systematic follow-up? Is there support for mental health, which can take a hit after serious illness or surgery? If you're traveling far from home, knowing that structured recovery support is part of the deal, that's huge.
You really boost the confidence in choosing that destination.
Definitely.
And the range of services under this medical tourism umbrella, it's pretty vast, isn't it?
It really is. It covers almost everything. You've got the preventative side, things like general health checkups, maybe comprehensive physicals for executives.
The routine stuff.
Yeah. But then you swing to the other end, the really high-stakes treatments. Things for complex conditions like cancer, heart problems, major orthopedic surgery, neurological issues.
And then there's the whole area that maybe gets the most press, aesthetics and restoration.
Right. Cosmetic surgery is a big driver, no doubt. And dental care, that's massive. We'll get into that.
Okay.
But don't forget rehabilitation, physical therapy, things that might require longer stay. Even specialized mental health services are part of it.
And traditional medicine, too. You mentioned Vietnam earlier.
Exactly.
Right.
Especially in many Asian destinations, you see the integration of traditional methods alongside modern medicine. That appeals to patients looking for a more holistic approach, something that perhaps feels missing from purely Western models sometimes.
So it really boils down to a very considered decision by the patient. They're weighing quality, efficiency, cost, yes, but also the overall approach to healing and recovery. It's quite sophisticated.
It really is. It's moved far beyond just bargain hunting.
Okay, so we've defined the overall concept. Now let's zoom in a bit, because within medical tourism, there are these distinct specialty markets, right?
Absolutely. And the reasons people travel for, say, cancer treatment are very different from why they might travel for dental veneers. The decision-making is highly specialized.
Right. Here's where it gets really interesting. Looking at what specific procedures pull people across borders. Let's start with the really serious stuff. High-stakes treatments like cancer care. Why fly around the world for that?
Well, when you're facing something complex, potentially life-threatening like advanced cancer or serious heart disease, or maybe a complex neurological condition, the decision to travel is almost always driven by seeking something specific you can't get at home.
Like what? Better doctors.
Sometimes, but more often it's about access to specific advanced technologies or very specialized expertise. Or maybe the waiting list at home for that specialist or that machine is just too long. They're basically chasing the global cutting edge of treatment.
So what does that cutting edge look like? What kind of techniques are we talking about?
We're talking about things like immunotherapy, treatments tailored to your specific genetic profile, or precision radiation therapy, hitting tumors with incredible accuracy, maybe advanced minimally invasive surgeries like induced endoscopic procedures that allow for a quicker recovery.
Things that require massive investment.
Exactly. Huge capital costs for the equipment, plus very specialized training for the medical teams.
So the key point here for these serious conditions is that medical tourism isn't about finding a cheaper, less advanced option. It's often about finding a superior option, technologically speaking.
Precisely. It's about accessing a higher level of care that might not be available or accessible quickly enough locally.
Which countries have really become leaders in this high-stakes market?
Our sources consistently point to places like Germany, Singapore, South Korea, Japan, and Thailand. These countries haven't just built impressive hospitals, they've successfully marketed their clinical excellence.
How did they do that?
Often through things like publishing success rates, highlighting their advanced technologies, and ensuring very smooth pathways for international patients, including crucial post-treatment monitoring. That follow-up is vital after something like cancer treatment.
Okay, that makes sense for the complex stuff.
Yeah.
Now, let's shift gears to another huge segment. One may be driven more by cost and aesthetics. Dental tourism.
Ah, yes, the dental market. It's enormous, especially for people from countries where dental care is incredibly expensive, like the US, Canada, or parts of Europe.
Things like implants, veneers, crowns, they can cost a fortune, right?
Astronomical sums. And often, insurance coverage is limited for major restorative or cosmetic work. So if you need extensive work, maybe multiple procedures.
Combining it with the trip, maybe recovering somewhere pleasant, it starts to look financially attractive.
Very attractive. It turns what could be a series of expensive, stressful appointments back home into a single, more manageable project, potentially saving thousands, even tens of thousands of dollars.
But there must be concerns about quality, surely. Flying abroad for dental work. How do these destinations reassure patients?
Quality assurance is absolutely paramount. They know they have to overcome that initial fear. So the successful destinations, places like Thailand again, but also Hungary, Costa Rica, they make a point of highlighting their dentist's credentials. Often trained internationally, maybe in the US or Europe.
But you mentioned something earlier, a specific certification?
Yes. JCI. That's a really important signal.
Okay, let's clarify that. What is JCI?
JCI stands for Joint Commission International. You can think of it as the gold standard globally for hospital quality and patient safety.
Like an ISO standard, but for healthcare.
Sort of, but much more clinically focused. To get JCI accreditation, a hospital or clinic has to meet thousands of rigorous standards. Everything from surgical safety protocols, infection control, how they verify staff qualifications, patient rights. It's incredibly thorough.
So it's like a seal of approval recognized worldwide.
Exactly. It's the healthcare equivalent of, say, a Michelin star for a restaurant. It signifies a very high level of quality and safety commitment.
That really puts the example of Costa Rica into perspective then. You said its capital has 3 JCI-certified medical centers.
That's right. And that's not accidental. It's a deliberate strategy. It sends a powerful message to potential medical tourists, especially those feeling nervous about traveling for something like complex dental work. It says, we meet the highest international standards.
It provides that concrete reassurance.
Absolutely. So the competitive edge in dental tourism, and increasingly other fields too, it's built on that combination. Proven high quality, often shown by JCI, efficiency, quick procedures, and of course, competitive pricing. Get those three right, and you have a very compelling offer.
It turns a necessary evil into a potentially positive experience.
That's the goal. It's the sign of a mature, well-run medical tourism market.
Okay, so we've established quality is critical. And that means the country itself, the whole system needs to be strong, right?
Yeah.
Not just one shiny hospital.
Absolutely. People traveling for significant medical care, they're looking at the overall reputation of the country's health system. Is it generally reliable, clean, competent? That overall quality perception is huge.
Which is why looking at global health system rankings gives us some clues, and some of the leaders might be surprising.
They can be. Our sources pointed out some interesting examples, often countries with really strong public health foundations.
Like Portugal. That statistic was pretty startling.
It really was. The 2020 Global Retirement Index gave Portugal's health system a score of 99 out of 100. #1 globally, based on those criteria.
Wow.
That kind of ranking sends a powerful signal about the general standard of care, the training, the infrastructure across the board.
Yeah.
It builds trust, even for the private facilities targeting medical tourists.
And Spain, right next door, has a similar reputation.
Yes, the WHO consistently ranks Spain's healthcare system among the world's best. They have a widely accessible public system, which sets a high bar. Medical tourists using private facilities there benefit from that overall high standard. The well-trained doctors, the modern equipment, but often at costs significantly lower than, say, the US. Maybe a third of the price sometimes.
So these top rankings aren't just luck. They reflect sustained investment over time.
Definitely. You don't build a world-class health system overnight. It takes decades of funding universities, setting rigorous training standards, prioritizing public health and safety. That foundational strength then allows a private medical tourism sector to flourish on top of it.
Okay, let's shift focus to Asia now. We see some major players there who've carved out really specific niches. South Korea, for instance.
South Korea is fascinating. They've really capitalized on their advanced technology sector and, frankly, a cultural emphasis on aesthetics to become a global powerhouse in the cosmetic surgery industry.
So people travel specifically to South Korea for that.
Absolutely. They've branded themselves extremely effectively around high-tech, sophisticated cosmetic and restorative procedures. It's a very specific market dominance.
In Japan.
Yeah.
Maybe less focused on tourism, but still appealing.
Japan's appeal seems based more on its long-standing reputation for meticulous quality, high standards, and advanced technology in general medicine. Its quality assurance rooted in sort of cultural precision.
Then there's Thailand, which seems to pop up in multiple areas.
Thailand is a real heavyweight. They've managed to build strength across different segments. On one hand, they're a top destination for complex, specialized care, like some types of cancer treatment we discussed.
Right.
But on the other hand, they are also a massive hub for high-volume, cost-effective services like dental tourism. They're playing successfully at both the high-stakes end and the high-volume end of the market. Very versatile.
And what about Vietnam? Our sources mentioned it as an emerging player in de liche photo. What's unique about their offering besides cost?
Vietnam is interesting because, yes, the competitive costs are a major draw, and they have a growing pool of skilled doctors and improving facilities. But a key differentiator is the way they often integrate modern medicine with traditional practices.
Ah, that holistic approach again.
Exactly. So a patient might get modern surgery or physical therapy, but their recovery plan might also include traditional acupuncture or herbal medicine seamlessly blended in. For patients seeking that kind of combined approach, which is quite common, Vietnam offers something distinct.
So it's not just competing on price, but on the type of care model.
Precisely. It's finding a competitive edge based on the scope and philosophy of care, which helps it stand out in a very busy Asian market.
Okay, this feels like a really important point. If a country wants to attract patients for complex procedures, heart surgery, cancer treatment, major joint replacements, The quality can't just be about the surgeon's skill during the operation. It's got to be about the entire system, especially recovery and rehab, right?
That's exactly the pivot. The shiny operating theater is one thing, but the real test of a top-tier medical tourism destination is the strength of its entire health system,
Yeah.
particularly how it handles complex recovery and manages patients with existing conditions.
And often, the people traveling for these big procedures might
Yeah.
be older or have chronic illnesses already.
Which is why looking at how a system handles sophisticated elderly care is such a good benchmark. Geriatric care demands the most comprehensive, holistic approach, a real safety net. If they can do that well, they can likely handle complex cases generally.
So let's dig into that safety net. You mentioned the Comprehensive Geriatric Assessment, the CGA. This sounds like more than just a standard checkup before surgery.
Oh, much more. CGA is fundamentally different. It's multidimensional, it's holistic. It's not just about finding diseases, it's about understanding the whole person to create a truly personalized care plan.
So it looks beyond just the medical chart.
Absolutely. It assesses their physical health, obviously, but also their functional ability at how well they manage day-to-day tasks. And critically, it includes social and environmental factors.
Like what? Where they live.
Yes. And things like, do they have social support? What are their financial circumstances? A top-tier system recognizes that things like loneliness or stress about money, or even just living in an inaccessible home, can massively impact recovery from surgery.
Especially if you're a medical tourist, potentially recovering alone in a hotel far from home.
Exactly. The CGA tries to capture that whole picture to plan support effectively.
And they use specific tools to do this systematically. We saw mentions of things like the EFI, the Barthel Index. What's the main takeaway for a patient seeing these terms?
The takeaway is reassurance, really. It signals a high level of systematic assessment. The Electronic Frailty Index, or EFI, helps clinicians accurately gauge a patient's vulnerability to complications. It's risk assessment. The Barthel Index measures activities of daily living ADLs. Can they dress themselves, feed themselves, manage basic mobility? Using these standardized, validated tools tells the patient, we're following global best practices to understand your needs and minimize risks. It shows they see the whole person.
And within that CGA process, there was one specific element highlighted: the medication review. It might only take 5 or 10 minutes, but why is it so critical?
It's a massive safety checkpoint, especially for older patients who are often on multiple medications for blood pressure, cholesterol, pain, maybe diabetes.
Polypharmacy, they call it.
Right. This quick review isn't just counting pills. The clinician asks, are all these drugs still necessary? Are the long-term goals they were prescribed for still relevant now, especially before or after a major surgery? Are there potential interactions? Side effects that could hinder recovery? Can the patient even manage the regimen correctly?
So it's about aligning the meds with the current situation.
Exactly. It prevents potentially serious complications down the road. Adverse drug reactions, falls, confusion. It's a hallmark of a careful, quality-focused system.
Let's make this more concrete. Can we look at some examples of how this high-level planning works for specific conditions often seen in medical tourism? Maybe starting with cancer care protocols.
Sure. A top cancer center offering chemotherapy, for example, must have detailed protocols for managing expected side effects. Take leukopenia, that's a dangerous drop in white blood cells, a common risk with many chemo drugs.
Good.
High-quality systems, our sources confirm, have protocols that mandate the use of preventative drugs like GCSF for patients identified as high risk.
GCSF, that's the drug that boosts white cell production.
Correct. And high risk isn't vague, it's clearly defined. Patients who've had chemo before, those with low counts to start, anyone who's had recent surgery, people with liver or kidney problems, or often simply patients over 65 on certain chemo regimens.
So the protocol automatically triggers this preventative measure for those specific groups.
Yes. The fact that such a specific, evidence-based protocol exists and is followed rigorously tells you the institution prioritizes safety through standardized, high-reliability processes. That's the kind of meticulous planning a medical tourist is paying for.
What about a really common chronic condition like diabetes?
Yeah.
How does high-quality management show itself there, especially in a surgical context?
Diabetes management requires real nuance. One key detail highlighted is the risk of asymptomatic hypoglycemia, low blood sugar, without the usual warning signs. This is more common in older patients or those on intensive insulin therapy.
Right.
But here's the subtle expertise. In patients who also have late-stage kidney disease, their kidneys don't break down insulin as quickly.
Ah, so they might need less insulin than expected.
Exactly. If the medical team doesn't recognize this specific interaction, the kidney disease affecting insulin clearance, they could easily overdose the patient, causing dangerous hypoglycemia. Managing this requires careful, specialized monitoring and knowledge. It's another sign of a system geared towards complex patients.
It's clear that the best systems are proactive, not just reactive. They focus on supporting health during recovery. Nutrition and physical activities seem key here too.
Absolutely fundamental. Good nutrition fuels healing. The guidelines are specific, ensuring adequate intake of key nutrients for older adults like calcium, potassium, folate, vitamin D.
And you mentioned D3 being preferred.
Generally, yes, for better absorption, although D2 is the plant-derived vegan option if needed. The system needs to know these details.
And protein needs might be slightly higher during recovery.
There's some evidence for that, yes. Maybe closer to 1 gram per kilogram of body weight rather than the standard zero point 0.8, particularly for older hospitalized women to help preserve muscle and bone. But just as important as the grams and milligrams
All right.
is eating pleasure,
Great.
making sure the food is palatable, enjoyable. If patients don't like the food, they won't eat enough, leading to unintentional weight loss, which seriously hinders recovery. It sounds simple, but focusing on taste and enjoyment is crucial.
Okay, well, what about physical activity during recovery?
High-quality recovery plans build in appropriate activity following guidelines. For adults 65 plus that generally means aiming for 150 minutes of moderate aerobic activity a week, or 75 vigorous minutes, plus strength, balance, and flexibility work twice a week.
That sounds like a lot for someone recovering.
It's adapted, of course, to their condition and recovery stage, but the principle is to maintain function. And interestingly, the sources even mentioned using mental techniques like visualization.
Like picturing yourself lifting your grandkids.
Exactly. Simple mental tricks to boost motivation and help people stick to their rehab exercises. It shows a focus on the psychological aspect of recovery, too.
Which brings us to mental health support directly. It has to be part of this comprehensive picture, doesn't it?
Non-negotiable in a top system. We know depression and anxiety are common, affecting maybe 14% of older adults. Major illness, surgery, loss of function. These are significant stressors.
So the staff need to be trained to spot this.
Yes, caregivers and clinical staff need to recognize the signs of psychological distress, maybe sadness, hopelessness, feeling overwhelmed, and ensure that appropriate support, whether it's counseling or just sensitive communication, is integrated right alongside the physical care.
So all this infrastructure,
Yeah.
the detailed assessments like CGA, managing chronic diseases carefully, focusing on nutrition, activity, mental health, it all connects to another big trend, doesn't it? Accessible tourism.
It's a perfect synergy. Accessible tourism is all about making sure travel is feasible and comfortable for everyone, including people with disabilities, mobility issues, or specific health needs. That means accessible transport, hotels, attractions, information.
And the scale of it is huge.
Massive. Our sources estimate maybe 1 in 5 tourists globally, that's over 250 million people a year, have these kinds of specific access requirements.
So the market for travel that combines health needs, mobility needs, and leisure is enormous.
Exactly. And the facilities and infrastructure needed to support high-quality medical tourism, things like accessible rooms, trained staff, smooth transport, are precisely the things needed for accessible tourism in general.
So becoming a top medical tourism destination forces a country to upgrade its accessibility for everyone.
Pretty much. You can't really excel at one without addressing the other. The holistic care demanded by complex medical tourists helps lift the standards for all travelers with specific needs. It drives system-wide improvements.
Okay, reflecting on all this, it seems the real story, especially for patients seeking complex care abroad, isn't just the specific doctor or the price. It's the confidence in that whole underlying system, that comprehensive safety net we just discussed.
I think that's exactly right. So what does this all mean? It means the destination's truly succeeding in the long run. The ones building sustainable medical tourism sectors, they're the ones who've mastered these often unseen parts of patient care.
The behind-the-scenes stuff.
Yes. The cost savings might get you interested, might book the flight. But it's the robust systems, the JCI accreditation, the detailed safety protocols like for GCSF, the sophisticated geriatric assessments, the focus on holistic recovery, including mental health. That's what builds trust, drives repeat business, and ultimately leads to better outcomes.
So the really calculated decision for the patient, they're weighing the cost, yes, the waiting time, yes, but also the perceived depth and quality of that entire care infrastructure.
You as the patient aren't just buying a single procedure. You're essentially buying into a whole systems approach to your health and well-being during a vulnerable time.
And that demand for high-quality, comprehensive care is pushing standards up globally.
It has to. Patients are becoming more informed, more discerning. They're comparing systems, not just surgeons. Whether they're choosing South Korea for specialized aesthetics or Portugal for its overall system strength, they're looking for evidence of excellence.
Which leads us to that final provocative thought you mentioned earlier.
Right. So far, the main model for doulator for medical tourism has been the patient traveling to the provider. You go there, get treated, recover. But think about the technologies we're seeing emerge. Advanced remote monitoring, AI-powered diagnostics, high-quality telemedicine. Could the model flip?
How so? Providers reaching the patient instead.
Potentially, or perhaps a blend. Imagine a future where your ongoing health, maybe a chronic condition, is continuously monitored remotely by specialists, perhaps based in another country known for its expertise in that area.
So you could be on vacation, but
Yeah.
still under expert medical supervision.
Exactly. Imagine blending that continuous personalized monitoring with your leisure travel. You get to enjoy a destination, relax, but your health is being proactively managed in the background by experts.
Making every vacation potentially a preventative health measure.
It could shift the paradigm. Instead of travel just being for episodic treatment when something goes wrong, the destination itself, combined with technology, could become part of your continuous health maintenance strategy. It's a fascinating possibility for the future of integrated health and travel.